Hi, this is Dr. MJ coming to you from beautiful Boston, Massachusetts. This is the Women in Dentistry podcast, where we feature women in dentistry making waves and leading the industry through the next decade. I am your host, Dr. Mary Jane Hanlon, a former dental assistant, dental hygienist, and now dentist. I am very pleased to introduce you today to Dr. Anita Imadomwanyi. She is the Director of Clinical Support and Charitable Giving for Aspen Dental Management Incorporated, ADMI, one of the nation's largest and fastest growing dental service organizations. At ADMI, she serves as clinical liaison to both providers and office teams, while enhancing support programs and resources provided to doctors. As Director of Charitable Giving, she supports Aspen Dental's Healthy Mouth Movement outreach initiatives, which includes veterans programs, day of service, and Mouth Mobile, to provide free dental care to veterans in need, as well as the Healthy Smiles and International Dental Outreach Program to provide oral health care and education to children, individuals, and family in need. It is now my pleasure to bring you to my interview with Dr. Anita Imadomwanyi.
Anita, I'm really excited to talk with you today. Thank you so much for joining us. Can't wait to hear about your story and how you get into dentistry. So if you would love to share with the audience, we'd love to hear how.
Don't forget to hit the subscribe button to our channel. And also don't forget to hit the bell so you never miss out on a single episode. Thanks so much.
Absolutely. And first and foremost, thank you so much for inviting me on this podcast. Absolutely love everything that you're doing with this podcast in terms of empowering women and allowing us to use our voices on this platform to share our experiences and our stories and hopefully inspire others, just as we have been able to have great impact in the industry. So thank you.
Oh, my pleasure. Thank you for being here.
And I'm happy to be here. So a little bit about me. I've been practicing dentistry. It's been nearly 12 years now, and I've taken on several roles in the industry. Currently, I am Director of Clinical Support and Charitable Giving for Aspen Dental Management Incorporated. And it's one of the fastest and largest, dental service organizations in the nation. So it's an honor and a pleasure to be a part of this organization. So my role at Aspen Dental is to be, I wear two hats at Aspen Dental, one of which is the clinical support side. So that's really empowering and inspiring doctors, coaching them, training them with the right resources and tools to excel, both as clinicians and as leaders in their practice. And that includes the business management side as well, being a support and a resource system for them. So what that requires is a lot of travel. I have a division that I support. It's the Southeast Division. And really going into those offices and being shoulder to shoulder with those doctors and, giving them insight and best practices on, how to manage their schedule effectively, how to develop and coach your team, how to collaborate with certain resources that we have in the office, like lab. We have lab techs in the office. And just other insight, other best practices. And then the other hat that I wear is overseeing our Healthy Mouth Movement program, which is our philanthropy program. And we have two veteran programs, one of which is the Day of Service, and then the Mouth Mobile, which is a 42-foot long dental office on wheels.
Oh my gosh, I didn't know you guys had one of those. That's awesome.
Yeah, we do. I call her the Big Blue Beauty.
Oh, that's awesome.
So she's traveling all over the United States, making about 30 to 32 stops a year. And for those particular programs, they provide free care to veterans. So with Day of Service, we stay open. Most of our offices will open specifically on a Saturday and provide free care to the veterans, and then the Mouth Mobile that travels. The other program that I oversee and lead is our international. It's called the Healthy Smiles program. So it's an international dental mission trip where we travel all over the world, are immersed in the cultures, providing free comprehensive care and oral health promotion and education to those in need, from remote villages, pueblitos, wherever we can, that we can have that, geo footprint to provide that care. So I feel fortunate to be in this type of role because it really allows me to harness my passions, which is mentoring and coaching, as well as the philanthropy side. So I have a nice blend, along with adding, a lot of that clinical expertise. And prior to Aspen, I was a dental director for the Texas division of DentaQuest Healthcare Delivery, and in conjunction with being the residency director for NYU Langone AGD in Dallas. Yes. And so I had the opportunity to, collaborate with NYU Langone because they wanted to establish AGD sites in Dallas. So this was the first of their kind. And it was really from the ground up, from the strategic planning to, identifying, the residents, recruiting them, identifying the right talent from a faculty standpoint, and coaching and developing them to prepare for this program that we're going to have in place, to facilitating the academic curriculum, and even going through the CODA accreditation. So we were able to get CODA accredited within that first year, which was like
That's
unheard
amazing.
of.
Yeah, that is pretty amazing. Good for you.
It was unheard of at that time. And I have to say, even thinking back on it right now, one of the biggest accomplishments I could say from that experience was not only, having the opportunity to work with other doctors and coach and mentor them, and, on so many different levels, like I've shared previously, but from the residents. When you talk about, this podcast being a way to inspire the next generation, that's really what it was about with that residency program. We had 3 residents, and these were individuals who were not from this country. So they were trying to make a way for themselves and for their families. And 2 of the individuals were leaving their previous country because of genocides and famine and things like that. So they came with such a compelling story and experience and journey. And so it was almost like it was up to me to be like their dental guardian angel here, and make sure that they had the most enriching academic, professional experience. So it put a lot of my heart and soul into that program. And they ended up being in the top 2% of the program. They finished their graduation or their residency program requirements within 6 months
Oh my gosh, of being there?
of being there, all 3 of them. Yep.
Wow. Congratulations.
Yeah. And we still keep in contact. One of them recently over the holiday, she sent me a photo of her child that just turned 1 and told me great things about now her, jumpstarting her career in the industry. She wanted to become a pediatric dentist, and she did that. And it was because of the foundation that was laid and the type of experience that she had when she was in that residency program and the opportunities that were afforded to her. So I keep in contact with the others as well. But even before that, I've taken on different roles in both the private and public sector of the industry, from associate dentist to lead dentist, again, dental director. So I've come with a breadth of experiences in the industry over the last 12 years. Been involved in different organizations over those years, have a very strong passion for the philanthropy side. So that has always followed me from the time I was young, through me now having the career that I have and ensuring that I can still find ways to give back and utilize my talents and skill sets, to do that. So that's been amazing. It's been an amazing journey.
Well, you can hear the passion in your voice for what you're doing. And obviously this job found you. You didn't find the job. I mean, it's one of those things that's how the universe works, because,
Right.
When you're so aligned with the mission of what you're doing, you can't stop people like that. They just they just soar. It's amazing. Congratulations. That's wonderful. How did you get into dentistry originally? What made you interested in dentistry?
Oh, that is an amazing journey, actually, because it really started young, MJ. I was probably in elementary school, And you know how you start to think about your life, like you look back on your life and you're like, where did this start to kind of mold? Where did it start to take shape? And it started then when I was young and I was bullied in school because of my smile. You know, I know you're probably like, what?
What? You get beautiful teeth, obviously.
That's what orthodontic treatment and money and investment does, for one. But back then, you know, I had really severe overbite, overjet. I was bullied. A specific bully used to call me Bugs Bunny. I had a lack of confidence. I know you mentioned confidence. How does one establish confidence over time? So that really shattered my confidence. And you think, you know, early on, it's a very impressionable period as an individual. You know, you're learning yourself, you're learning about the world and its ins and outs and relations to others. And here I am being bullied and I don't want to smile. I don't want to, you know, really interact with people. I was very, very timid, at least in school, you know, and my parents saw that as an opportunity to do whatever they could to invest in my smile. And even during that time, I always used to think like, I wish I had the ability. Like I didn't even think about myself. I was like, I wish I had the ability to help people fix their teeth and change their smile. For some reason, my little brain back then would say that. And I wouldn't even think about me, myself. You know, I didn't make the connection like how this was truly affecting me, you know? And it started to take shape. And eventually my parents were able to scrounge up the money and I was able to start the orthodontic care. And I tell you what, the moment that I met my orthodontist and he said that he's going to give me the best smile ever as a 10-year-old, I mean, my eyes lit up. I think that was the first time that I smiled in his chair. And we hadn't even started orthodontic care. So you can only imagine, like, once we went through that process and I started to see the shift and I started to see the changes and I started to look towards the future and imagine myself with this amazing smile, this butterfly, this, you know, it was like a cocoon coming out of that and now blossoming into this butterfly and spreading her wings. That was a game changer for me. And I went through that care for about 4 years. So when I was in high school, freshman year, braces came off and I was awakened.
Yeah.
It's like how Anita got her groove back at 14 years old.
Mm-hmm.
Fortunately, because that had already planted that seed and it hadn't gained its articulation yet, if that makes sense. Like it had planted the seed, but again, I hadn't connected the dots. Like, how do I get to that point? In high school, they had a program called clinical rotation where you were a selected few and you could rotate through the hospital and you could shadow different healthcare providers. Not only the hospital, you could you could shadow a psychologist or a psychiatrist if you wanted to, or a dentist. And that's where it happened. They didn't have, interestingly enough, they actually didn't have dental on the list.
Really?
They didn't have dental.
Yeah. Well, now that's because medicine doesn't believe teeth belong to the body. I don't know.
Exactly. They had medicine. I know. So that was even however long ago it was back then. So yeah, so they didn't have dental. They only had medicine, psychology, psychiatry. So I went to the clinical coordinator and I said, you know, I'm interested in hospital and really I want to rotate through cardiology and ICU. Like I love that intensity, you know, watch those shows. I want to be there. I want to be in the action. But is there any way that I could rotate into a dental office? And she said, you know what, we don't even have that as part of our program. I said, that's interesting because it's part of the healthcare profession. And she said, you make a good point. If you can find a dental office that will take you in and allow you to shadow for the next, year, or if you decide to continue for the next 2 years, then we'll coordinate it. We'll integrate it into the program. And I said, you wait. So I went to my family dentist, Dr. Andrea Lai, and I proposed it to her, and she was more than happy to take me in.
Of course she was. She was probably so excited.
Oh my gosh. I mean, I've been going to her for however many years. She was the one that referred me to the orthodontist. We had a great rapport. I respected her. I saw her as an icon because of what she was doing. I'd never seen that before. Back then, you weren't seeing a lot of women, in the industry, in the dental industry, let alone in other healthcare professions in that type of role. She owned her own practice. So I did my rotations exclusively with her most of the time. And the light bulb just went off. That was it. That was it. And already in my heart of hearts, I knew I want to become a dentist. I want to be like a Dr. Lai who has overcome obstacles. First generation really here in the States. She comes from a Vietnamese background that has been able to graduate from college, graduate from dental school, one of few women in her class at NYU, and now be a practice owner and be a successful one at that, and a well-revered one in the community. So I owe a lot of where I am today to just having these different touch points earlier on in my life from my family, especially my mother. Oh my gosh, and you'll probably hear more about her later on. My mother, Dr. Lai, who actually later on, a few years back, passed away from cancer. Yes. So, it's like you have these different people in your life that you want to, when they touch you in such a way or they inspire you in such a way, you feel compelled to continue their legacy.
Sure.
You feel compelled to keep going, keep fighting, keep moving, keep excelling, because you know that there were people before you who laid the groundwork. They laid the foundation, so you got to keep doing it. So having that type of motivation and then taking it and running with it from high school, focusing academically and everything on doing the right things, making the right grades, taking the right courses and excelling to put myself in a position to go off to college and then pursue this dream of being in the industry. And this is someone who is, first generation here in the States. So this is from a family lineage of parents that came and emigrated from Nigeria here, wanting to live this American dream and provide for their children, their 4 children that they would have later on. And, dad only has a high school degree. He ended up being an entrepreneur. Mom, who also only had a high school degree. So there was a lot of motivation. And maybe even a lot at stake, honestly. And I'm the firstborn too.
So a lot of responsibility on those firstborns, I'll tell you.
It is. It definitely is. And then when you add the cultural, tradition, customs aspect to it too, it heightens that level of responsibility. So that's the journey to how I came to be in the industry. And again, I owe a bulk of that to my angel, my mom.
So she obviously is the one person who inspired you the most and has given you the best piece of advice. Tell us a little bit about her.
Thank you. She's amazing. She's amazing. And I use present tense because she's still with me, even though she passed away.
Good for you.
Yes, she is amazing. Again, she came here with only a high school degree.
That gave me the chills, by the way. Oh my gosh, what a wonderful thing to say. I mean, your mom is she's beaming right now.
Oh my, it gives me chills all the time, because you never forget. You can only let it live on. And what I can say is this is a woman who came from a time, her and my father came from a time of Nigerian civil war. There was genocide, there was famine, families pulled apart, torn apart, especially my dad. And all they wanted to do was get away and live a good life and establish a good life for their families. So, they wanted that American dream. My dad came first. And then a couple of years later, my mom came, and then eventually I was born like a year later. But she came with only a high school degree, which is not recognized here, right? And all she had really to her name was some of the classes like mathematics and science, home ec, the traditional female-oriented classes. That's what she took that she really excelled in, but that's all that was offered to her.
Sure.
right?
That's a way to, when I reflect back on situations like that, that's a way to control the women, because you don't want to give them too much education, right?
Right, because maybe too much education is too much power and more resistance or whatnot. So she came here and, her first job was like working in the kitchen. She was working in the kitchen and with individuals who spoke Spanish. So she actually learned how to speak Spanish. She became, I guess, trilingual. She spoke multiple languages, including the Nigerian dialect. And she would come home and she would teach me Spanish. So I ended up becoming trilingual as well.
Wow, that's great.
But then over the years, after she had had all four of her children, she said, you know what? I want to go back to school. And she talked to my dad, and my dad was the breadwinner. He was working his 70 hours a week and, really making sure that we had food on the table, we had clothes on our back, and we had all the necessities and then some, where it didn't feel like, we were, that we didn't know how, we didn't know that we didn't come from the best of beginnings from from a financial standpoint. So, they decided, okay, let's have her pursue this. So she ended up getting her GED. She ended up getting, I'm going to fast track this story. She ended up getting her GED, her associates, her bachelor's, her master's, and her PsyD over the course of the years of, I think, 14 years. She ended up acquiring those degrees and being magna cum laude for every one of her degrees. And get this, this is where the turning point is. She did this while she was diagnosed with cancer. Her first diagnosis was breast cancer. And I remember, I think I was in 7th grade or so. I mean, I was young, and my siblings were even younger. One of them was in diapers, I think. And that was a big change for me too, because already in our culture, where when you have your firstborn and it's a girl, they revere you as a second mom, and they really raise you to be the second mom. Oh, so much so that they take away your name and they kind of bequeath you the role of what we call an auntie. So that means second mom. So now, my siblings, anyone who's younger than me, can no longer call me Anita out of respect. They have to call me auntie, even to this day.
Wow.
I had to step into that role while my mom was going through that cancer. And even through that, she was going to school. When they did a double mastectomy, and back then when they did those type of procedures, it was like they had no like respect almost, or like consideration for how that would make a woman feel, how it would affect them from a femininity, from a self-worth standpoint. I mean, it was like they chopped off her breast, literally.
And that was it, and sent her home.
And sent her home. She had bags dripping. And when I tell you she had out of this world strength and perseverance and steadfastness, she did. She always came with a presence, eloquence, glamour, and classic sophistication, with tubes hanging down, studying late at night, and still making sure her kids were tended to. And then obviously delegating to me to make sure, my brothers, their homework was done, helping her to cook. She taught me how to cook actually from the time I was 6. So, giving me all of these different responsibilities and really training me to be this like well-rounded, almost like I call myself a Renaissance woman, where you don't hold back, you don't let anything, hold you back. You just go in and you do all that you possibly can, that God has given you the ability to do. And you set your bar high. So for me, there's no excuse. There's no excuse to go to dental school. There's no excuse to not seek other opportunities in my career and try to excel and be the better version of myself every day. And as I continue to grow, and there's no excuse to back down. There's no excuse to stop. She didn't. And she did that while having 4 kids, maintaining a household, and she pursued her dream. She pursued her dream, and she studied clinical psychology and child development. So that was what her focus and her degree was. unfortunately, she passed away. And when she did, she was literally like about to finish her dissertation. Like she had like one sentence left.
Oh,
And the program gave her her degree.
it's the right thing to do.
That's right. So they honored her degree. So on her tombstone, it says, Dr. Patricia Ndidi Imadomwanyi, because, it is the right thing to do. And she put in the work. And her story,
Isn't crazy.
yeah, beyond that, she was also a strong voice in the community, local community, and even nationwide, traveling all over the nation to speak about breast cancer awareness.
Wow.
Yes, she was hometown hero several times. She was in trade magazines, in newspaper articles, did op-eds. She also was a strong advocate, like one of the major voices in sickle cell disease awareness, because my sister has sickle cell, and she lost two sisters in Nigeria to sickle cell.
Wow.
So she was well-rounded. I mean, she was doing all of that.
All while going through chemotherapy.
Going through chemotherapy, having a daughter who has sickle cell, and who's also, there was one point where her and my sister were in the hospital. And, I don't know how they facilitated it and how she was able to go over to where my sister was. And she always had that recurrent message of, you got to fight. You got to be strong. Mommy's here with you. She'll never leave you, but you got to eat. You got to garner up your strength. You've got to, move your limbs, get some circulation, like, talk to your auntie. And I was always, by my sister's side, and always talking to her. And, even to this day, still being that support system, just like my mom was, just like she was for all of us.
Sure. Now, is your dad still living? Do you mind if I ask?
He is. After she passed away, he actually was diagnosed with cancer.
Oh, gosh.
And it was non-Hodgkin's lymphoma. And fortunately, he was able to survive and overcome that. And so it's nice to know that, we're not orphans, one, and nice to know that he's in good sound health, and, he's doing okay. He's doing okay, and he's been able to move on. Because that time period was a very challenging time, losing one, and then having the other one, and the unknown around that too. So.
Oh, I'm sure it must have been devastating to all of you to think about losing both of them in such a short amount of time.
Mm-hmm.
Yeah. Loss like that is significant. I lost both my parents within 11 weeks. Now, both older, but, still, it was tragic for us because, it's almost like my dad died of a broken heart because he just couldn't be without her. And, it was a really sad time. Just not, but you have all those memories, and I see the light on your face just beaming at the memories of your mom. And so you're right, she's still alive. I mean, it's just a different energy level on a different plane, but she is still alive. And, obviously she sees what you're doing and so proud. And, it's just, it's a great story of inspiration. So thank you for sharing that.
Absolutely. Absolutely. I feel like I'm, if I can do my due diligence, I believe in testimonies. I'm Christian, so I believe in testimonies. So I feel like if I can do my due diligence and share her story, just as it's been an inspiration, empowerment for me, hopefully it'll be the same for others outside of my family.
I'll share with you that we've had several students diagnosed in school with breast cancer, and one had ALS, significant medical issues. And, between the students helping each other and supporting one another and the families, they all made it through. And so, unfortunately, you don't always know what happens afterwards, but we have been extremely fortunate to be able to see the success of these students, even though they were so ill. So it is perseverance. It is resilience. It's like just putting your blinders on and staying focused, and you got a job to do and you're going to do it. And, good for your mom. Good for them too.
That's right. Absolutely. And I think it also comes down to, that's when you really see support come to life. Like for people who think that they made it in this world and they did it on their own. I feel like it's hard to really say that, because when you start to dig deep and you think back to your past experiences, the people that you've had in your life, you have to give acknowledgement and kudos and respect to those, whether it's from your household or it's some person that you met randomly on the plane that just gave you that one piece of advice. Like it could be anything, but support is huge. And, I take a lot of the type of support system that I've had over the years, and support system that my mom had or my sister or whoever, I take that as how I need to support others throughout, through their career, whether it's their dental career or professional, growth and development.
I think that, when you think about that, it's the ripple effect, right? One word, one breath, anything can have a ripple effect on somebody's life that changes the trajectory forever. And that also happened to me. So, but this is not about me. But I will say that I would not be where I am today if somebody didn't tell me I wasn't smart enough. Because don't tell me I'm not going to be able to do something, because I'm just going to show you that I can't.
That's right. That's right.
And I think about that man all the time. And I share this story all the time. But I think about this person and I say to myself, I wish I could just say thank you. He didn't know. I mean, he was being a jerk, obviously, and that's not a way to encourage a 14-year-old. But, he inspired me to do more and be more. And I remember going to bed that night and saying to myself, there is no way anybody is going to tell me what to do or how I'm going to do my life. There is no way. And that has been the fueling fire my entire life. So kudos to them. Kudos to all the people out there that say something that is just perfect, even though it's negative. It does have an impact on our lives.
Absolutely.
Tell us one thing that people would be surprised to know about you.
There's a couple of things, actually. I think typically on a day-to-day basis, obviously in the dental organization that I'm a part of, people know me, right? But outside of that, day-to-day basis, I think people typically are surprised that, one, I'm a dentist, let alone I'm in the type of role that I'm in. So a dental director, and they're like, what is that? And then I have to, enlighten. And then the other is that I'm also a professional baker. So when people hear the two, they're like, wait a minute. So you fix cavities and then you give cavities. And then my quick response is, hey, everyone needs job security. And then they kind of chuckle from that. But it's interesting. And I say that because I've talked about this on several panels and even a podcast, is that people have a frame in their mind of who they think you're supposed to be, how you're supposed to dress, or what kind of car you're supposed to drive. I remember a patient one time saw a specific car, it was this luxury car in the parking lot, and thought that he automatically assumed that's my car because I'm a dentist. That's my car. And he didn't know that I didn't have a car. I don't like cars. And I drive a lifted truck that has big tires. And when he found that out from my office manager, because I didn't say anything, he was shocked and he had incredible respect. He's like, wait, doctor, I has a lifted truck? So it's amazing because when people hear me say dentist, they're like, I wouldn't have pegged you for a dentist. And, when I do ask, what would you peg me for? They're like, maybe a model or an actress or, I don't know, something like in the business sense or marketing or social media influencer. And I'm like, interesting how the times have changed. But I think that also goes along with part of it is how they view an individual and their own conceptions or, thoughts. And then even working off of stereotypes too, right? And then the other part of it is, me being a woman, where can we categorize me with respect to how people view men versus women in certain industries?
Yep.
So it's like I have the best of both worlds. I'm a dentist and I'm a professional baker. If they had to choose two, they would think I was a baker first before a dentist.
Mm-hmm. When you compare the male and female thing, it brings me up, it reminds me to ask you a question. So when you were going through dental school and even during your career, have you ever felt any bias against you because you're a woman?
That's an interesting question. Because I went to dental school at University of Southern California. And at that time when came in as a D1, we had 70% males
Wow.
and 30% females. When I graduated though, it went from 70 to 60-40. So it was 60% male and 40% female. Now, today, I believe it's about 52% female.
We're 64.
Look at that.
64%.
So with that, there was definitely, I can't really say that I had any type of experiences per se that had to do with me being a woman in the class or through the program. If anything, I did see and I did feel sometimes even differences in how I was treated from female faculty.
Ah, interesting.
Maybe even more, they were more assertive or they were more demanding or
Critical.
more critical, exactly, more critical than the male faculty, but it was only a few of them. So I'm not going to generalize because we have exceptional faculty at USC. And I mean, again, I wouldn't be the clinician that I am today without having those humble beginnings. So if anything, that was some of what I experienced, but even so, I still had a great rapport with even those faculty members. So I can't really say that that was the case. And I think that, I was in dental school at a time where it shouldn't be the case anymore because a lot of due diligence has taken place before then. But like a Dr. Lai, who was my mentor for so long, I mean, she had that. She definitely had the, men do it better than women, extractions, you're itty bitty and tiny, maybe you should focus on getting into pediatric dentistry kind of thing. Where, I remember when I was in dental school, I actually wanted to be either an orthodontist or an oral surgeon. I mean, I was going for the top. And I was very encouraged and supported through it all from, our head of our oral surgery department to our head of our pediatric department. Whatever it is that I set my mind on or wanted to aspire to do at USC, I really did have a great support system from the school. And I say that, and I can say that with confidence because, and I didn't mention this before, my mom passed away when I was a junior going into my senior year of dental school.
Wow. Tough time.
So, there was a lot of compassion that was showed upon me. And I didn't get special treatment. So I didn't get special treatment, but there was a lot of empathy and understanding. And I think there was consideration for that as well. So in that type of trying time, and what could have been a huge setback, maybe I wouldn't even be a dentist today. It was nice to know that there was that strong sense of community in the program to help me get through it.
I got to say that I think dentistry is one of the tightest knit communities of an industry that I've ever seen. It's small. Everybody seems to know everybody else, especially in your local area. I just find, and especially during COVID, there was so much support there for each other. And, we're all in this together and we're going to get through this, the whole bit. So I have to say that I am really happy to be a part of this industry. I just find it to be, it's still, I'm not even going to tell you how many years later, but a long time later, still fuels me, and it still makes me want to get up and go to work every day.
Absolutely. And I think back to the history of the profession and how much it's grown and how much it's advanced, innovative technology, the disruption in the industry for the greater good, create opportunities for you and I be able to be in this industry and to excel in this industry and take on leadership roles in this industry, especially as women. But also from a holistic standpoint, the industry compared to other healthcare, sects has kind of been the underdog and has been in many ways disregarded and not seen as to that level of you are true and true healthcare providers. But yet what we do on a day-to-day basis directly impacts the lives of individuals, and not just from an oral health standpoint, but from a total health standpoint.
Absolutely.
And everything else that you would think of from a psychosocial development or psychosocial standpoint that dental impacts an individual. So I feel as though because of that, and because, learning and going through some of those growing pains together, no matter what sex, gender, affiliations you have, I think that's what has allowed us to come together so strongly in this profession, and then to leverage how we can better support ourselves, both as individuals, but also as professionals. So we have the likes of now, organizations that people can really feel like it's relatable, whether it's an Indian Dental Association or American Association for Women Dentists or ADA or whatnot. There's a plethora of areas that people can get involved and be a part of something and still feel like they're still part of, the greater good with the industry.
I'll give you a little background on the differences and why it was separated from medicine way back when. One of the deans of one of the first medical schools looked at dentistry as a mechanical performance, right? Whereas medicine was more intellectual and, learning. And when I think about this, my question to people has been, because I really am passionate about integrating medicine into dentistry. So that's a topic for another day. But what I realize is that there isn't anything non-mechanical about every single thing that we do and that medicine does. I mean, think about doing cardiac surgery. You have a pump, a heart pump, pumping the heart while you're going through surgery. So it's all mechanical, but that was the reason why we were sidelined. They also thought that we were crackpots, that only illiterate, stupid people would pull teeth out. And I think, it's funny because the perception that the mouth is separate from the body has got to stop, because, if you had an infection in your foot, you wouldn't cut your foot off, would you? No, you wouldn't. So, an infection in the mouth is affecting everything in the body, and it has caused so many issues for people that, it's time for the profession and for all of us dentists to wake up and say, okay, it's enough of the silos. Let's put these aside and let's really focus on how we can work together to support our patients. I mean, really, that's the number one goal. So next question is, do you have a motto that you live by?
I would say it's something that my mom told me when I was young. And she said this in, her native tongue, which we say native tongue, but her native language. And it went a little something like this: never forget where you came from, where you are today, and where you will be tomorrow. And she said that at so many points in my life, whether I needed to hear it or I wanted to hear it, she made it known. And it didn't mean that it was relative to a specific context at that time, but it was always a reminder to humble oneself. And so I've lived by that since I was young.
Yeah.
And I actually, when I coach doctors and I coach teams, I try to resonate that message as well. Never forget where you came from, where you are today, and where you're going, or where you want to be tomorrow. Because when you remember your background and you honor it too, no matter what that background was, maybe it wasn't the best, maybe you didn't have the best upbringing, or maybe you didn't have, all the resources available to you back then. Maybe there were challenges, or there was strife or death in my case. Use that as an opportunity to fuel you and as a learning experience. And then check yourself for today. Know who you are. Never let go of who you are, right? Because that all contributes to who you are. But you also contribute to who you are. The choices you make, what you seek, the opportunities that you're trying to gain, what you do and what you don't do, those decisions that you make or don't make are all going to affect who you are. And then have a vision for tomorrow. Don't just settle for today or say, okay, and just don't settle, period. Always be looking for, how can I be a better version of myself? How can I do better, be better? and have it clear in your mind. This is my vision. And what do I need to do to get there? And what kind of support, again, humbling myself, what kind of feedback or coaching,
Or skill development.
skill development, exactly. What do I need to help me get there? And then get there. Don't let anything stop you.
Right. So what does the Anita of tomorrow look like?
Ha! Well, the Anita of tomorrow is mommy because I'm 4 months pregnant.
Congratulations. That's best profession there is.
Absolutely. So I'm looking forward to that. My husband and I, every day there's always something that we're talking about with regards to future baby Gallo. That's my married name. So that's future mommy. And really, what does that look like from a work-life balance? Because back then, before I married my husband, or we married, I was single, and family and work was what I had. And of course, hobbies and things like that. And so, I always thought I knew what work-life balance was, but now that I'm a mom, I've got this baby growing in my womb, and I'm thinking of the future, it's how do I map that out? What does that look like? And how is it going to work for me when I think of who I am and checking myself, who I am and what I want when it comes to my career and things like that. So work-life balance right now has been at the forefront of my mind. And then the other piece would be continuing to propel my career. I'm in the role that I'm in, and it's afforded me great opportunities. I've traveled all over the world, doing the things that I love with philanthropy and giving back. And I want to continue to do that and develop more programs with regards to our philanthropy side, and even take on my own personal initiatives with regards to that too, because that's been so heavily ingrained in me from the time I was young.
Absolutely.
So hopefully that answers your question.
It is awesome. And I could, many of us know exactly where we're going, but we don't visualize it, right? And I find that is the number one key for creating your future, is to visualize it into being. And, I don't know where I learned it. I started doing that from a very young age. I never not saw myself as a dentist from a very young age. So it took me a long time to get there, but I always knew I was going to be a dentist. I just knew. And so, I think that is a critical piece of this, is that you need to have your vision. And if you're not clear on your vision, you're like a sailboat without a rudder. You're just all over the place and you don't know where you're going. So,
Yeah, especially in this type of industry, especially being a woman in this industry, because now there are so many opportunities to do so much in this profession. I remember when I was first starting off in the industry, and it was like you could only be one thing. You could only be an associate. And then if you wanted to be more, you had to leave that position or leave that office to go and do something else. Or, if you're going to be an owner, you're only going to be an owner. Now, we've got women that are on dental boards, women that are leading these major organizations, whether it's dental or not. They're executive director of this, chief of this, CEO, dean, associate dean. They're taking all these leadership roles, being in trade magazines. People are asking them for their opinions, being industry leaders and stuff like that. So I think this is the time where kudos to you again for putting together this type of podcast, because this upcoming generation needs to know that they got to keep going. There's no excuse. There's no excuse. There's so much available to them, literally fingertip away. You can just click and you can listen to a podcast. You can go on social media and you've got this amazing rock star female dentist that is doing great things, and she's got her cases, clinical cases that she's featured, and she's featured in this and on this talk show. There's so many, and she's a working mom, 3 kids, devoted life. There's ample opportunity. You just have to stay grounded, and you got to seek it out. You mentioned that you had paid off your loans, I think you said, right? And that you were giving that counsel to those dental students. I get that question a lot because part of what I do in the clinical support role, I do collaborate with a lot of these academic institutions, and so I get to talk to a lot of different dental schools, dental students, and about career opportunities, whether it's with Aspen or beyond Aspen, and they do talk about, how do I pay off my loans? Like, how does this work? And I'm like, dude, I came out with $450,000 debt and I paid it off. But you have to be focus driven.
Exactly. Oh my gosh.
You got to have clarity. Like, you got to come out and at least have some insight, do some introspection, but some insight into what you want to do. It may not be as clear, but at least, okay, I want to start off as an associate. I want to get mentorship and then seek it out. Or I want to be a practice owner in like 3-4 years, and then start working with mentors and coaches that will help you map that out and reach that goal.
Absolutely.
But it can be done. And as a woman, it definitely can be done. I mean, I was a single woman. Yes, I didn't have children or whatnot, but I had other responsibilities, and I still made it happen. And I know of many doctors who are practice owners, multi-unit practice owners, women who, because of that, they've been able to pay off their loans. Or single mother doing it in the grind, in the trenches, and has the grit and just makes it happen. So I hope that, through mediums like this, we are able to continue to empower this next generation of women to be leaders and great clinicians and so on and so forth, because the time is now. Like, there's no excuse in this industry now. There's no excuse.
Totally agree. And the one other piece I would add to that is that, you're never too old either. Your mom went back to school. I went back to school when I was 35. And, of course, I was much older than all my classmates. And, they still embraced me and made me part of the class. I could give a little bit of wisdom at that point, just because I was a mom. I did have a mortgage to pay and all of that kind of stuff. But you do have to be extremely focused, and you have to have a plan. One of the things that I'm really adamant about with my students is teaching them the financial piece and the financial side of this and the responsibility that comes with it. And that, you don't need that Prada purse or whatever it is that tickles your fancy, or the Ferrari car to drive around with. No, you don't. You know what? It's just stuff, right? It's just status stuff that, if that makes you feel better, okay. But wait until you pay off your student loans first. Prioritize your financial situation, because let me tell you, you get to your 60s and you don't have that prioritized, there's a lot of anxiety. I've seen it. And especially in dentistry, there's only about the rates, I think at one point, there was only about 10% of dentists in this country that had their financial future secure when they retired. And that's why so many dentists continue to work at an older age, because they're not where they should be, or they woke up too late. So don't wake up too late. Start saving very early.
Exactly. When I had graduated dental school, speaking of that and like having a vision, my classmates at that time, especially after my mom passed away, I pretty much gave up the vision of going into specialty. I decided to go into a GPR because it was like, I'm grieving. I only have so much strength. I was on the track to, really excel on the national boards. And when I came back from her funeral, all I wanted to do was take it and be done with it and keep moving and finish, graduate on time. And I remember, telling some of my classmates, like, even when I came into dental school, I always knew that I was only going to be chair side as a clinician for 10 years, no more than 10 years. And then,
Really? You already knew that?
I already knew it. And maybe part of it is because I have entrepreneurs in my family. My dad is, like, literally everyone in my family, immediate family, is an entrepreneur, including myself. But I always knew that. And so having that vision, like, okay, my clock is 10 years, and then I'm still going to be in the industry, but I'm not going to be within those four walls of the office. I may be beyond the chair doing other things like philanthropy or what I'm doing now. And it all fell into place. Or baking, right. But the vision was clear. And so it gave me that track of, I was really only chair side for 6 years before I transitioned into more of this type of role, the business management, coaching doctors type of role. And so 6 years, that fast track is where, I gained a wealth of experience as a clinician and really furthered my career, but also, was able to take on different opportunities and see different sides of the private and the public sector, and really hone in on, grounding myself to ensure that I could pay off those loans. Because what I didn't want to have happen is, my cutoff was 10 years and I'm still having to pay off, $300,000 loans. So I wanted to put myself in a position where I didn't have that. And that happened.
Good for you. Congratulations. It's an amazing feat because, not everybody can do that. So congratulations. That's really great. Now, you brought up being a mom, and I think one of the biggest pieces of learning that I had when I was a mom and went back to school was, I was so guilty personally, thinking, oh my gosh, she's not going to have her mom at home and all that kind of stuff. I will tell you, it was the best thing I could have ever done for my daughter. And I'm sure you realize this as well, because you watched your mom study all the time and learn and be brave and do something and bold that, she did it at an older age. And most moms don't do that, right? When I think back, my daughter is a kick-ass boss.
I
When
like
I
it.
say that,
Get it, girl.
pretty formidable. I will say, she was working for the CEO 2 years into finishing her MBA degree. So, it's when we speak more by our actions than we do by what we say. So when they see us doing these great things, that inspires them to do great things. And it may not express itself right away, but as adults, it always does. So I just wanted to share that piece of advice as you enter into this new era, and it's going to be amazing and kill you at the same time.
I know. Oh my goodness. I mean, there's so much that I'm learning, and obviously I'm going to learn along the way. And I love that advice, and thank you. And I humbly accept that piece of advice. And it's something that I've thought of, because when I mentioned, work-life balance earlier, what I was thinking of is, okay, so what is that going to look like when it comes to me returning from maternity leave? What's that going to look like with regards to like my travel schedule? And, because I travel quite a bit, and not just domestically, obviously for our international programs too. And there's other, commitments that I have with regards to my role. But one thing that has always resonated, and again, I love that you mentioned this, is the fact that, number one, my mom did it.
Yeah.
My mom did it. And I want, hopefully, if it's future daughter, even son, to know that mommy did it, or no holds bar. She came with the grit, she came with the passion, and she did it. And she still loved me unconditionally, and made sure that, we were provided for her and my dad. And she led by example, with the diligence, with the perseverance, with the courage, with the strength even. She did it and found a way to balance it. She was still there for our soccer games. She was still there. We were having our date nights, and we had our movie night, or we were cooking together or baking together, but she was always present, even if she was away. That's the message that I want, my children to have, and to see me hopefully as a good example.
And I think too, both male and female need to see that, because I think our young men, and it's very different now than it was when I was bringing up my daughter, but, men need to see strong women. Little boys need to see their moms as strong women, because it's only going to help them become better partners as they mature and they get married and look for a spouse.
Yes. And I want them to see that there was a legacy. There was a legacy from my mom. There was a legacy from their grandparents. There's a legacy from their father, and that they channel all of that. And it gives them the encouragement and the empowerment and sense of self and awareness to pursue the things that they want to pursue in life, and to do it with passion, and do it well, and be successful, whatever that means for them. I think that's the ultimate message. So I'm embracing this journey And this next chapter, I can't wait. It's exciting. Baby is due in June. So
Oh, beautiful time to have a baby. Oh, I'm a June baby, but it's a great time. It is, because it's warm out, you have the summer, you can take the summer off. You probably don't have to go back until the middle of September. Oh my gosh, it's wonderful.
And when's your birthday?
21st. Yeah, I actually think I have the best birthday in the whole year because it's the longest day of the year. And I remember as a little girl thinking, oh my gosh, I have all this sunshine. God made it special for my day. I remember thinking that, and, it's little did I know that, it was the summer solstice, but I realized that there was so much sun because it stayed light out until 9 o'clock at night, and we could still play outside because that's when you had to come in when it was dark. Little tidbit. I have to say that I have thoroughly enjoyed our conversation and getting to know you a little bit, Anita. I just can't believe it. Any last words of wisdom for our students out there or any young women starting to pursue their career in dentistry?
Anything is possible. It may sound cliche, and we see it a lot. We've seen it in nursery rhymes. We've seen it in movies and shows and things like that. But there's a lot of truth to that. Believe in yourself and don't let anything stop you. We have great pioneers that paved the way for us to be in the place that we are today, and know that nothing and no one can define you. Only you can define how you want to be defined. And for me, dentistry does not define me. I define the dentistry that I want to practice and how I want to be. And I take on the resources to, be in that industry or be in this industry, but it doesn't define me. So, and I'm not defined by being a woman. I'm defined by being me and what I bring forth to the table and my talent and knowledge and whatever the case may be. So know that you're not defined by, your sex or your race or your affiliations, circumstances. You're defined by you. So let those choices lead you in a way that will allow you to continue to grow and excel, both in your professional career, but also in your life. And seek out mentors. Don't shy away from it. Take on mentors, because I'm a firm believer that you should always have a coach. Even to your dying days, there should always be something or someone who is providing a sense of, providing coaching or development or leadership or whatever the case may be for you. But seek that out, because that also is going to help you to continue to grow.
Absolutely. Great words of wisdom. Anita, thank you so much for being with us today.
Thank you for having me, and thank you for what you're doing. Thank you so much. Keep it up.
Thank you. Thank you so much for listening to the Women in Dentistry podcast with Dr. MJ Hanlon. If you like our show and want to know more about us, check out our website, thewomenindentistry.com, or please leave us a review on iTunes. Join us for our next episode as we bring you another amazing woman leading the way for the next generation.